Does your knee osteoarthritis prevent you from keeping up with your grandchildren? How long has it been since you've been able to get onto the floor and then back up again? I bet your idea of retirement was from the top of the hill, not from the bottom. Now, I'm here to tell you that the dream isn't over, that you can still live an active and adventurous life with knee osteoarthritis. In this video, going on from our previous videos, I'm going to give you 4 advanced exercises for your knee osteoarthritis that you can do starting today from your living room. This is going to help with improving the amount of movement you get in your knee joint. It's also going to help strengthen all those muscles surrounding your arthritic knee and supporting that arthritic knee. It's also going to assist with a bit of pain relief to help you manage every day. As always, everything you see in this video is general in nature and it may not be right for you. And before starting any new exercise regime, it's best to consult with your doctor to make sure it's right for you. And if any of these exercises increase your level of pain, then I advise to stop them immediately and consult with the appropriate healthcare professional. Here are my 4 exercises that you can do from your living room that are a bit more advanced than the previous ones. So the first exercise is the sit to stand. Now, the sit to stand is a potent exercise for increasing the strength of your quads, for strengthening your glutes, which by now you know are quite important in osteoarthritis, as those glutes really control how that femur tracks and how you are biomechanically. It also helps with a bit of strengthening of the hamstrings as well as your calf muscles here. Okay, so overall, brilliant exercise for rehab of knee osteoarthritis. So, the previous videos we just showed you a simple sit to stand, and then we had our mini squat. But today what we're going to do is an advanced version. What we're going to do is say my right knee here is the affected knee. It's the one with the arthritis. Okay, we're going to have that one a little bit further back and our unaffected side a bit further in front. Now, we're just going to stand up exactly like we did before. And you should feel a lot more pressure going through this side. Now I'm going to show you from a better view. Now I'll do it with the left side back, okay? So we probably want our foot position about this far apart, okay? And we're just standing up, slow on the way down, standing up again. And again, as always, we're going to try and work up to around about 20 reps. Now, the second exercise is the glute bridge, which is an exercise I did in my first video if you want to check that out. What we're going to do here is a version that makes it a bit more difficult, a bit more challenging for you guys, all right? So, we're going to set ourselves up into the exact same position. So just like this. So originally our bridge was just coming up, and again we want to push our lower back into the lounge. Okay, come up. But in this version, what we're going to do is we're going to have, this is our arthritic knee, we're going to have it close, we're going to have the other leg a bit further away, and then now we want to come up. And hold for about 2 or 3 seconds, and down. Now we're putting most of the pressure through this side. So, again, in that first video, I showed you we had our feet up on the edge, and we're doing a hamstring exercise where we just kind of push our heels
into the armrest, just like that. Now in this exercise, we're actually going to try and lift our bottoms up, just like the bridge. It's very important to keep your heels as the direct contact into the armrest, and your toes facing the roof. So this one is quite hard, so just be ready. You might not be ready for it, but it's worth having a try. So we want to come up just like that, and down, and up. And you should really feel in your hamstrings here, which is the back of your thigh, okay? So again, pushing our heels down, trying to really poke those heels into the armrest, and then lift our bottom up. Should really feel that one.
Fourth and final exercise is one completely different to the others that we've done in the other episodes. Now, this exercise is targets the glutes, however, mainly the glute medius, which you have 3 glutes. You have your big glute maximus, which I'm sure you've heard of. You also have the glute medius and glute minimus. So the glute medius is extremely important for pelvic stability and also to control that knee. So if you're noticing that when you do your sit to stand and your knee comes in like that and you don't have good control, that's generally your glute medius, which is up here, okay, and it contracts like that, yeah, and works to control that knee. So what we want to do now is to strengthen that, and to do that without any equipment, I think the best thing you can do is to lie on your side, just like this, and then we want to come up, hold it for a couple of seconds, come down, up again. We should be aiming to feel a bit of a burn through this part here. Alright. So again, with all these exercises, we're going to try and aim to get up towards the 15 to 20 mark. Okay, in the previous videos was definitely aiming for 20, but these are quite advanced and might be quite a bit of a challenge to try and get to 20 reps. So I think it's best to aim for around about 15 if you can. And then in future videos, we might get some equipment out to try and challenge you a little bit more. So I hope you enjoyed this video and all the exercises in them. I hope they give you some benefit. Please like and subscribe so this video can reach people who really need it. If you'd like to leave a comment on what you'd like me to do next, or just a comment on what's your biggest struggle with knee osteoarthritis. And thank you for watching.